Okay, hi guys. I'm here today with the gorgeous Rosemary, who is a integrative pharmacist. She's a lot more than that though, but that's how I met her. I met her when I had found out about the battery in my mouth and I was told to come and get a whole heap of different protective medicines. So we'll go through them in a minute, but basically I met her just from talking to her over the counter at the chemist and found out that she is a lot more than just a pharmacist and a lot more than an integrative pharmacist. So Rosemary, can you please tell me the list, because I know it's long, and I would love for you to explain to us what your qualifications are.
So I'm also qualified as a functional medicine practitioner and a integrative life coach.
Okay.
So I bring that all into the session.
Yep. So tell me about that. How did you become a functional medicine practitioner?
So I guess it started quite a number of years ago, so I think I should start there. So, as a pharmacist and as a pharmacy student, I was very curious about people's health and conditions. So I didn't just want to give them their medication and counsel them on that, but I wanted to know about them and how everything was going for them. So I was very curious about the underlying workings of the human body and how that presented itself to the person in front of me. I was also very interested in the nutraceuticals, so supplement side of things. So I'd read all the labels, and we did training. So pharmacy was always had that. We had the pharmaceuticals, but then we also had the nutraceuticals. So we got training on that as well, after our university degree. And I found it was really interesting, and so I would recommend products, and patients would come back and they would, tell me how they're going, and I'd get information, real life feedback. So that also sparked an interest and curiosity in me. And then, then I had my own health issues as well, and I did the usual thing, you go to the doctor, you ask them what they think it is, and they give you their treatment. None of it really worked. So there was a few years there of frustration, and I went to see specialists as well, and that cost me a lot of money and still didn't work. So it's like, what else, what next? So I just really took it into my own hands, and being a health professional, I knew I had other things, other resources to draw on, and I was going to go down the natural path rather than the drug therapy.
Yep.
So I did that, and after I did that, my health conditions all cleared up. Like, it was actually a really bad skin rash that I couldn't get rid of, and I had brain fog, and I had really bad gut issues, so there were a few things there.
So what were the explanations for the skin from the medical doctors, from the Western medicine?
I can't remember what exactly. I don't think they gave it a name. I think they thought it was a fungal infection. So I went on the antifungals, long course of it. But I think that affected my liver and my gut a little bit more. So it just continued, and it was a bit of that or dermatitis. Yeah. So it helped a little bit, but just not enough, and it just wasn't going away. So I went on that path, and then that opened my eyes up. And then from there, I just looked into functional medicine, and even more opened up to me. A whole another world opened up to me. So, yeah.
And what did it take for you to do? What did it take for you to get that title as a functional medicine practitioner? Yeah.
So if you're already a health professional, you can do an accredited course in functional medicine. So you can do it, through, there's different avenues, different schools. I decided to do one from America, because the Americans are quite further in front, I believe, than Australia. And it was quite a good course. So that took me a few years to complete, and here I am. But then also after that, after functional medicine, I decided, I work in the pharmacy still, and I was presenting, treatment plans to patients, but there wasn't a lot of uptake, and I realised that something was missing in my approach, and it was connecting with the patient on that. deeper level of understanding who they were. And once you understand more about who they are, you can really form a bridge for them to come across to realizing that they have an ability to improve their health, you know, not just through take this drug and this is the rest of your life.
Like a blood pressure tablet.
Yeah, you know. And I was taught that. I was taught, you know, this is essentially just how your body is now. It's not reversible. You just have to be on this for the rest of your life.
Yep.
And these are the side effects you need to watch out for. But for me, that just didn't sit completely with me. And I think that has to do a little bit with my upbringing and just my personality and my philosophy in life. So, essentially I was lacking something to get that message across. And I realized, what else do I need to do? So that was the next question. And it was life coaching. That's what fell into my lap next. And that was one of the best things I could have done for myself and for my patients as well, I think. And through that I learned a lot about myself, a lot about connecting more with my emotional center, my emotional intelligence rather than my intellectual intelligence, and bringing those two together has really formed a new level of integration for me. And that's why, you know, and functional medicine is this amazing banner that encompasses all of that, and very scientifically as well, which I love. So
what would you say would be the biggest difference between functional medicine and like Western medicine, like what I learned at university? What would be the big differing part of it, or philosophy of it?
I guess from my perspective, in university we learn that what we can see, we treat.
Yep.
Okay, what we see, we treat. So that's why we look at symptoms, and then we diagnose our symptoms, and then we have a drug that matches those symptoms to control those symptoms, which otherwise could be life-threatening, which is very important, you know, as a doctor, as a pharmacist. It's very important to know those things, and then the side effects, and we're trying to improve the quality of life. However, functional medicine goes a little bit further. So we're changing our objective to not just symptom control, but we want to really get to the bottom of it. Not everyone wants that.
Yeah,
a lot of people do.
The why of it. Why do they have high blood pressure?
Exactly.
Not that they have high blood pressure.
Exactly.
Yes.
Yes.
Yeah. Oh, that makes perfect sense. So taking that step back, and that's basically what I talk a lot about in my book. But one of the things I was just about to say that I talk about in the book as well, which is very interesting, it just reminded me of what you just said. At the start of medicine, when medicine was first being sort of written down and becoming a sort of school of medicine, and this is like 200 years ago they started to study medicine as a degree. And it's funny because they really did say, if you can see it, it's a disease. If you can't see it, it's a disorder. And that's when they started to differentiate between, if you see it, if you can see it or cut it or squeeze it or anything, then it's real. And if it's not, then it's a disorder. And then therefore it becomes almost obviously psychological. And that was very much at the start of medicine. And obviously we've come a long way since then, but not as far as we could have. And that's why functional medicine comes in. Yeah. So that makes a lot of sense. So with the life coaching, what did you have to do to become a life coach?
Well, I learnt, so it was practice, like, what would you call it? So in-person practice as well. So you need to practice what you do. But I guess these days it all goes online since COVID.
Yeah.
But anyway, so it's online practice and then in-person practice. So I learnt things like NLP, Neuro-linguistic programming. Hypnosis was part of that, so I am a trained hypnotist as well. It's very interesting. I do enjoy that. I also learnt MBIT, so M-braining, and I love M-braining. Also, MBIT stands for multiple brain integration technique.
Okay.
So
can you elaborate a little bit on that? 'Cause I've never heard of that before.
Exactly. Yeah, so that was developed by two men, and a psychologist and an engineer. So, and it's in the realm of neuroscience. So, what they really took was the understanding that we have multiple brains in our body, and they are, your cognitive brain, and then you have your heart, and then you have your gut. And the reason that they were able to call them brains is because they have neurology of their own, a lot of neurology, enough that they can make discerning decisions. And once we tap into those brain centers, you'd be amazed at what you can discover about yourself and how that allows you to take better directions in life that are more in line to who you truly are and what you truly want. Because this brain up here analyzes things too much. So it complicates things more than it needs to. And then that stops us, that creates some cognitive dissonance where we cannot decide which direction to go for. And sometimes what happens is then our fear center kicks in, so that's our amygdala. So our fear and stress response kicks in, and that's going to send ripple effects through our nervous system, through a sympathetic drive, which we know about.
Yep.
But that's also going to impact on the decisions we make, and then we make poor decisions in life.
Yeah.
So if we
things like impulse control, addiction, those sorts of things, is that where the MBIT would come in?
It would come in definitely for those for those things. But essentially anywhere that you feel that you are stuck within your personal self or external self, it can help you find a way through.
Yeah. Because
we're accessing another level of intelligence that is already ingrained within us.
Yeah.
And it is our nervous system.
And how do you think people innately know this already, or do you think that we really need to be taught this?
That's a good question. So I think everyone knows this, but they don't utilize it. So when you get a gut feeling, like everyone's had a gut feeling, right? Yeah. But do you recognize that that's actually a true response that you need to pay attention to? Yeah. Or do you just, push it aside as, oh no, I've got some gut problems?
Yeah, and the number of times that you do push it aside, then that trains you to not trust your gut.
Exactly.
And be further away from that recognition of that true self.
Yeah. So you've associated it negatively.
Yeah.
Whereas we need to unlearn that process and relearn what we're supposed to actually be picking up in our bodies. Yeah. So the language of our body, really.
Very exciting. I can't wait to do that with you.
Yeah.
For me.
Yeah.
But what about the NLP? Because the Neuro-linguistic programming.
So really, that's through listening to your language. And when I listen to your language, then I can pick up your mental map. So we all have this map that we've created from the start of our life. And a lot of it, we are just a sponge. When we're little, we just pick up things. We model off those around us because we don't really know how to think for ourselves. We're just modeling. So we're picking that up. And then that's our basis for this map. And then we go and with this map, we create meaning out of other situations, events in our life. That becomes more of our map. So now we have this map, and really when I listen to your stories and your language, I'm picking up how this map looks. And then I'll work with that map and see if we can make changes to that through our language and through our other senses and visualization. So that's kind of how NLP to me works.
So is that where you pick up on things like early childhood trauma and how that's manifested in that person's might be their health attitudes or just their life attitudes in general and that sort of thing?
Yeah, that's why when we do an initial consult, say, I have to take a very broad health history, and that includes your upbringing. That includes not just your genetic history, but your emotional as well,
Yep.
history and your story, because that makes up who you are today.
Ultimately,
the
yes,
choices you make.
nature and nurture blended together.
Exactly.
Yeah.
Yeah.
So, like, obviously you're very unique, and I was very lucky to come across you, because it certainly wasn't planned, and I certainly didn't get referred to you or anything like that. It was just luck,
Yeah.
or the universe,
Amazing.
however you like to see it. But so how many people are out there? How many practitioners are out there like you that people in, you know, Western Australia, for example, could access?
I don't know of any who do exactly what I do. I've kind of gone out on my own limb,
Yep.
if that's how you say it.
Yep.
But there are other pharmacists that are doing functional medicine.
Yep.
Okay, there are other health practitioners doing that, which is amazing, and that's a great start, definitely. We really need that more accessible for people. So I know a pharmacist that has a counselling degree, and we have great conversations, so I love that part of it. But I don't know someone that does exactly what I do.
Yeah. So how would people watching this access somebody who's even an integrative pharmacist or a nutritional? Sorry, that's the wrong word. Integrate. Functional medicine practitioner. Sorry, I'm getting.
No, there's so many names.
My brain.
You can call us integrated as well.
Yeah. So and because
yeah.
I've been talking a lot about integrative general practice, and then it's like integrative pharmacy. It does seem to, you know, sort of follow along the same lines. Obviously, looking for the why rather than the what and how to treat. But with the maybe just with the functional medicine, how would somebody find a pharmacist who has done that extra work or has that sort of more open-minded approach?
Yeah, so I work for Pharmacy 777, and they are very progressive, and there is access to integrative pharmacists in that group.
Yep.
In the group that I work for.
And they do a lot of compounding as well. I know that because I've referred a lot of patients to get things compounded.
Yes. I would say just approach your local pharmacy and just see what they offer. You know, I'm also accessible in a clinic in Subiaco as well, AccuEase.
Do you have a website?
Not yet.
Okay.
Not yet. AccuEase does, so you can access me through them. I don't have a personal website, but
so
in the development of one. AccuEase, so ACUEAESE.
Okay. And then obviously this is where at Pharmacy 777 in Nullarbor, so you're accessible here.
Very, yes.
And so.
And this is our counselling room.
I know, it's a beautiful room.
We have
lovely.
a beautiful soundproof counselling room, because we actually are the only pharmacy, as far as I'm aware, still are the only pharmacy in Australia who has an in-house counsellor as well.
Yep.
So this is her room as well, and she's amazing.
And that's, I mean, it's all about the integration of all these services. And when I had my book launch on the weekend, that was what we were talking about. Everyone that was in the room, we had physios, we had integrative GPs, we had you, we had counsellors, we had naturopaths, we had patients, we had other authors, you know, other, everyone was there, and everyone was talking about we need to bring all these people together, because it isn't easy, like I said in my speech, it isn't easy to see somebody for 10 minutes and just go, oh, you're suffering from this horrible condition, or you're suffering from domestic violence, okay, I'll see you in 2 weeks. But to be able to have people to refer them to that you know are going to not just follow a very set out, you know, traditional psychological treatment plan for them, you know that they're actually going to go into a bit of depth with things like what you were saying with the programming, the brain stuff, and actually looking at how it affects the body as a whole.
Yeah,
so hopefully, fingers crossed, we can get things moving a bit more towards that direction.
Yeah, exactly. And I think we do kind of all need to come together, like-minded health professionals, because we are
support each other.
It's calling for it as well, and really help the people out there who are trying to search for us, really.
Yeah, absolutely.
Aware that we're available, that we're here waiting.
Yeah, and I had no idea. I mean, I was suffering from my symptoms for 2.5 years before I found my integrative GP.
I know,
And then to find you, just because I came here because this pharmacy was the only one that had the stock of a particular thing that I needed.
Yeah.
You know, we need people to be able to actually say, no, I want to go to these places first, or I want to, you know, like, I'm not happy with that 5-minute appointment. I want to, you know, pay for a good service, and I want to be heard and listened to and feel like I have gained something from that appointment. So yeah, fingers crossed, hopefully we can work on that, all of us together. But the more we talk about it, and the more we demand it, and the more we expect it, the more it will happen, I think. So
exactly, and it's such a interesting area to go down for our health, and it's really putting the power back in the patient's hands again as well, so they feel the confidence that they can actually do something about their health. Not just handing over the scripts
and putting the power in the medicine or the doctor or the pharmacist, because it's easy to do that. It's the easiest option, but it's not the best.
No, and in the end, you know, after you've gone down this path, you'll look back and you wonder why you didn't do it earlier as well.
Absolutely.
Really, it just gives people their life back. That's why I keep doing it, and I love it. It's so much fun.
Well, I'm so glad that you do. So thank you. Thank you for taking those extra steps, and yes, thank you for talking to me. And I will put all of Rosemary's details at the bottom of the video so that you can get in contact with her. And thank you very much.
Thank you, Anita.